Good morning, everybody. Welcome. Oh, I'm echoing. I'm not going to sing because I think that sounds terrible now, but welcome to this workshop, and we're going to talk about facilitating transition from child to adult in young adults with RMDs. My name is Judy Ammerlaan. I'm working at the University Medical Hospital in the Netherlands, and I'm a transition coordinator, but also a nurse researcher. So I'm not involved in any patient organization, but I work a lot with patient organizations. And we prepared this workshop with, I did it not on my own, but with a group, and I will introduce them to you. Here you see the pictures, and you see them live sitting over there. Lucy Gossens, my colleague, and Simon Stones, and also Linda helped preparing the workshop, and Nele from Belgium, and we had a lot of support from Esme and Beerte from the Eular organization. Now, what are our objectives during this workshop? We want to share and explore how organizations, patient organizations, can best support young people with RMDs in the transition from child to adulthood. But we also want to explore how organizations can support parents and carers. And we're trying to utilize the Eular press recommendations for transitional care as a basis for further dissemination. Now, these are challenges we have to face this morning, but we're going to make a start with it. And how we're going to do that? Now, we're going to listen to a case study. Lucy is going to present it to us. And we're going to listen to Simon, who is going to inform us about the Eular recommendations on transition. And afterwards, we are going into subgroups. You are sitting also already on a table, so meet your subgroup. And we're going to talk about the Eular recommendation, and we're going to explore how we can implement it in your own patient organization, in your own home. When I'm talking about transition, what am I talking about? There are different definitions of transition, and here you see the definition of Bloom. That's a man who did a lot of research about transition, and he describes transition more as a transfer from child to adult care, more in the context of a patient healthcare organization relationship. And that's one way you can look at transition. Another way is that we all make transitions in our lives, and perhaps one of the most challenges and important transitions is the one that you make from child to adulthood. To start this morning, it's early and some of you have small eyes, so I want to warm you a little bit up. We start with an icebreaker. As I look at the age, I think we all experience at one time in our life a transition, so I want to ask if you take a moment and think about your own transition and write down on the sticky notes that you have on your table. You can see it, if it's okay. And write down one positive word, experience about that transition, and one less positive word or experience about the transition. And I give you 1 minute to do that. Okay, thank you. I'll get back to the sticky notes. Where's the response? Before this conference, we asked you to share your thoughts and experiences on transition, and we got a lot of response, and I want to share some results of that. We see that 12 of the 52 delegates who filled in the questionnaire run activities specially targeted at young people. And we also see that 10 of the 52 delegates had done work especially targets on parents and carers. So we see that also the parents and carers are a part of the transition process. And 9 of the 52 delegates has been involved in developing the recommendations. And 45 of the 52 are interested in developing activities. And that's a good thing, and that is why we're all here today, I think. What are the activities you mentioned in the questionnaire? Well, some patient organizations targeting at young people, they organize youth camps or youth holidays. But they also run events and workshops. And they use materials specially focused on young people like leaflets or books or websites. And you all somehow pay attention to education in peer-to-peer support, but also in individual sessions or educational sessions. Some of you do these sessions amongst a group and lectures at school. There is also cooperation with medical centers, and some of you are very enthusiastic in involving in the Eular recommendations development. Well, we want you to get informed in this workshop, we want you to get inspired, and we want you to have some concrete ideas that you can use at home. So we hope we can achieve that this morning. And we start with an impression of the daily practice of Lucy Gossen. So I would like to introduce her to come over here. And we changed the microphone, so.
Good morning, everybody. Can everybody hear me? Is it loud and clear with the microphone? Okay. Thank you, Judy, for introducing me. I'm Lucy Gossens, and together with Judy Ammerlaan, I work in the UMC in Utrecht Medical Center in the Netherlands as a transition coordinator and nurse specialist. We work in a children's department, as you can see here, and in the adult department, as you can see here. Per year, we have 30 youngsters who make the transition from the child to adult care. And first, I like to start with a movie from a young adult. And in the movie, you see a topic we discuss a lot in the transition outpatient clinic. Yesterday she told me that I do double click on this one, but she erased it very nice for me, but I also have the movie.
Do you have it someone on the members?
Oh, this is it. Yeah. Yeah.
vanavond uit. En dat is echt heel lang geleden dat ik uit ben geweest. Vroeger liet ik me altijd gemakkelijk overhalen. Nog 1 biertje was het dan. Nou ja, daar had ik achteraf natuurlijk spijt van. Je wil zeg maar ook niet dat iedereen altijd maar weer denkt, oh daar heb je Marit met haar reuma. Ik wil dus gewoon net als zij zijn.
Hey, wow. Jij bent wel. Leuk om te zien. Hey. Ja. Nou, ik ben er weer. Dus ik ben een beetje curious.
Nou, ik slik dus MTX. En als je daar alcohol bij drinkt, dan kan je echt heel erg misselijk worden. Drink dan 1 biertje. Maar niet meer.
Dankjewel. Nou, ja.
Maar je vrienden kunnen natuurlijk nog wel eens aandringen.
Zullen we nog een beetje doen?
En dat is eigenlijk nog geen goed idee. Ga jullie maar lekker hier staan. Nee. En dan moet je toch weer zeggen, nee, dat kan niet. En dan bevestig je dus ook weer dat je reuma hebt.
Met z'n vieren. Maar 2 biertjes, dan kan het lekker aan. We doen nog op vakantie, ik dronk veel meer dan 2 biertjes.
Die mensen vinden het nog best wel eens moeilijk om te begrijpen. Ik zou willen dat ik wel wat beter ook voor mezelf op kon komen. Wat zou jij doen? Nou, ik ga vanavond.
But why is transition so important? These young adults are in search of their own personality and identity. There is a change in the air and they have to make a lot of choices. And then young adults with rheumatic diseases, they are growing up in conflict with the disease and treatment. They have a high disease activity and functional damage in 50% of the cases. And this makes the multidisciplinary treatment complex. Transition is in the age of 18, saying goodbye, meeting a different team and different care providers. And with this have a whole different culture too. What are recognizable transition problems? We see young adults with treatment dropout. They could be rebellious, and they are passive, could be passive, dependent, and not adherent. And we see parents who have difficulties with letting go, and the care providers could be unfamiliar with growing up. There is a discontinuity in care, and they could see the transfer as a moment instead of a process. We, as a multidisciplinary team, we formulated some aims, and we wanted to bring the two worlds together. And we want to support young adults towards the role of a leading actor. But these were nice aims, but where did we start? We started with asking the young adults what they want, and they answered, I don't want to be an exception, just simple. And your lifestyle recommendations should fit in my daily life. And tell me the limits where I can experiment in daily life. And promise me open access to caregiver and organization. And your information should meet my language. I want to be prepared and I want to be stimulated. And with this information, what does it mean for our multidisciplinary team? And what does it mean for me as a transition coordinator? We allow the leading role for the young adults. We communicate directly. We listen instead of speaking all the time. We let go of routine procedures. We define the play field rules. And we use other communication channels. And to support the transition, we use 3 electronic communication channels. We have the website youngendreuma.nl, Young and Rheumatism. There is a lot of information on this website for the young people with rheumatism. We have a digital patient record, so the patient can see their own record from their own house. With a login code, they can come in their own patient record and ask questions, see what the doctor is writing, and so. And Judy, she, together with the Rheumatism Foundation, she developed an online self-management training for young people. And we also work together with the patients' organization, like utawell.com. We heard yesterday already from it, and two of them are here. They organize transition events, like a sail camp. They have a chat, they have a website with information, and they put also news on it and on Facebook and Twitter. Knowing this all, what do? I'm a living bridge between the two worlds. I'm easy to access. The transition outpatient clinic is nurse-led, so me as a transition coordinator, I'm a nurse. I'm in close cooperation with a pediatrician and a rheumatologist. I make an individual plan meeting the needs of the young adults. I support self-management, give information and guidance. And in the consultation, I explain the transition process. The patient and the parents meet the transition nurse specialist, me, and the rheumatologist from the adult care. And we meet the young adult and their parents. And we discuss topics such as school, friendship, sport, and future. Simon is going to tell you more about the recommendation and how it fits in our transition clinic. Thank you for your attention.
Like to ask, is that possible only in your hospital, in your clinic, or there are much more possibilities in different towns in Netherlands?
Okay, thank you for your question. Shijana is asking if there are more outpatient clinics who have a transitional clinic in their hospital. We know that there is one in Holland, that's in Rotterdam. It's another city. But it's a really new thing in Holland too, yeah. And
colleagues in England, is it working? Yeah. Colleagues in England have a lot of experience with transition, so we use their experience. And what Lucy told us, Rotterdam is one of our colleagues, and we see in many places awareness for attention for this group, because they all experience that they don't have, from the caregiver team then, that there isn't enough knowledge and guidance for this group. And when they are on the adult side, we experience a lot of problems which we think of, why didn't we deal with that earlier? So we see a knowledge, awareness now. I'm working in transition now for 15 years, and the last 8 years I see this awareness growing. And the point that now transition is a main topic on this Congress and also on the Congress in London, you see that it's more landing by more people, not only by the patients' organization and the young people themselves, but also for the multidisciplinary team. So I think that's great. Okay. Now thank you, Lucy. We now give the word to Simon.
Right. As Judy and Lucy said, a lot more people are talking about transition now, but we're at that step where we need to translate them ideas into reality. And so back in 2014, Eular and Pare released some funding to do the standards and recommendations for transitional care of young people with RMDs across Europe. And so we are expecting to publish the recommendations within the next 3 to 6 months. It's now been approved by everybody on the group, and hopefully we can share them with everybody in the near future. But the recommendations were led by Helen Foster in the UK, a very experienced paediatric and adolescent rheumatologist with adult background. And she brought together a really nice mix of people to try and, through lots of discussions, develop these recommendations that were practical, realistic to everybody in Europe, and to set sort of the basic level what we should all be trying to achieve, and then the ideal level that we would like to get to. So if you're unfamiliar with the process of the recommendations, it starts with the formation of an expert group consisting of clinicians, patients, basic scientists, and a variety of other people, including allied health professionals. And it started with a review of the evidence that is already available, and that was in a systematic review. This then led into the setting of the framework, which we had a meeting in Zurich in October 2014 to start to draft the recommendations. We then went to a voting process where we had more discussions with a wider range of people, and then this came to a consensus where we drafted the final recommendations. So we had 9 representatives of countries across Europe. So you can see some of them there. Ideally, we'd have somebody from every country, but in terms of the money that's available, you have to be pragmatic. We had 24 professionals, including paediatric, adolescent, and adult rheumatology teams, because it's really important that we engage every individual within the specialities, because we want to work from paediatrics into adult. And we had psychologists, nurses, occupational therapists as well. We had 3 patient representatives, including myself, and 3 clinical academics as well. And in the review that sort of informed the recommendations, there were 6 different programs across not just Europe but across the world that was used to inform these recommendations. So we've got the ones from the Netherlands, the UK, Belgium, Germany, Canada, and the US. And this really helped to see what is available and what can we use across Europe to work together to help people transition into adult care. So in the end, we proposed 12 recommendations. It has to be not too small, but we could make 100 recommendations. It's got to be something that's practical. And this was based upon the evidence, the framework that we used from the evidence, and using the input of patients, parents, carers, and professionals. And these recommendations went out to 200 people as well to vote. So we tried to get the consensus view of a wider group of people. And really now we've got to the point where we've got these recommendations, and 3 of them are what we are going to be talking about today in the workshops. Originally, the recommendations are very clinical, but actually these recommendations should be accessible to everyone, including patients, the patient organisations, and everybody involved in the care of young people from the transition from paediatric to adult. And really what we want to do today is to develop them recommendations from paper into practice, because they are things that we should be working together to translate from theory to reality. So I think that leads nicely into discussions this morning.
Ask you one question. I saw in the team who worked on the transition recommendations together, I saw 3 patient representatives and 24. What do you think about that?
Ideally, I would have liked more patients and patient organisations, because there wasn't a organisation on the group, and I have fed that back to Helen as well.
Okay.
I think it's an important thing to remember, to try and get more people onto these groups, but I think they did try, but in terms of, it was a 3-day meeting and it's quite difficult to take time out. So no, I think the important step is to engage with patient organisations now as we start to translate them, because they're going to be stuck on paper, but we want to translate them. So I think it would have been ideal beforehand, but now we've got them. Let's try and use them to the best.
Okay, we have an opportunity now to translate them from paper to practice, because that's the second part of this workshop. We ask you in the beginning to put your thoughts about transition, a positive and a less positive thought of or experience about it. Svetlana, your group translated in Bulgarian, so I ask you to help me to translate some of the main findings that you see for your group.
It's quite...
Wait.
Interesting that just with one view I can see that some of the words that people has chosen are similar or the same. For example, I can see excitement, which is the positive thing, and some of them accept this transition as an opportunity for real good things to happen. These are the positive things, like fulfillment, like really stubborn things that they are able to reach their aims.
Okay.
Such things are the positive words here.
It sounds like power.
Yeah, empower.
Okay.
Yeah, and the other thing is there is one connected. Maybe this is a person who has already rheumatic disease at that age, and his or her words are connected with the condition. The one which is bad is that lack of information. So, and the other one is a kind of accepting mood variety, which is typical for teenagers. Difficulties to accept the things, which is normal for
I think so. Yeah. we have all experienced that, I think, but maybe it's a little bit harder.
Yeah.
Okay, thank you. I walk over to this flip over, and I looked at it earlier, and I see some similarities with that flip over. I see fear. Some of you described fear for transition, in the of an experience you experienced in that phase, and struggle, but also change and freedom. Freedom 2 times. I think that's great. Would any one of you say something about it, or is this enough? It's okay, sir? And here, also fear. That surprises me. Can anyone say something about that? Why you put down fear as a word? Can I give it to you?
Yes, well, I'm a rheumatic patient myself, but I'm also the mother of a youngster with chronic disease. And so I'm a parent, and what I saw and talked about with my son was that he experienced fear because he was in an, in an environment that was safe.
Mm-hmm.
And when he got to be 17, 18, then the environment wasn't so safe anymore. He was going to study. It was a world, he didn't know how people would be reacting to him. We had created a very safe environment for him. Yeah. School knew, was very positive, etc. And then you see the first thing they have, at least in our case, was fear. Yeah. Just fear. Going out.
Mm-hmm. I think you recognized a little bit about the story of Lucy, who explained the transition problems we experienced. And they're all general defined. Everybody experienced that problem, or not a problem, or a challenge, or an empowerment.
Yeah.
But we hear that a lot at the transition clinic, because it's also in a period of your life where change is in the air. And that change with the transfer to a new,
Yes.
maybe a new doctor, a new environment, the adult setting, will make it a little bit harder.
Yes, you know, it's very bitter to see. I have a daughter who has nothing, who has no chronic disease. For her, it was she couldn't wait to get out. She couldn't wait to discover the world. She is discovering the world. She's traveling, etc. That is not something for my other child. He needs an environment where he knows he has to rest, he has to take his time, he has to be careful. When he studies, he has to have a study environment that's, you know, safe for him, that understands him. I've seen a lot of other children with chronic diseases fail at university because there was no one who cared. I know there are protocols for youngsters who study, but if you go to faculties, etc., and you know, mathematics, etc., and they say, "Oh, we don't know what to do. You have to find out yourself." Okay. So the fear they experience is sometimes very real, and it translates into a real problem.
You say fear, I hear lack of information. And you're here as patient organization, you're from the Netherlands, and we're here with a lot of countries, so I think it's good to see if the recommendation Simon just mentioned, there are a few, but we're going to outline 3 of them today, can help you or empower you as patient organization in your land to see what you can do about it, with concrete ideas and plans. So I now will invite you to the second part of this subgroup meeting. You're sitting around 3 tables, and we divided you in 3 subgroups. So this is great when you're already sitting over there. And on every table we ask subgroup leaders, Svetlana for the Bulgarian delegates, and Lucy will join that table, and Simon will join you. And we are going to discuss 3 of the recommendations of the Eular, which I'm going to show you now. Svetlana, your group is going to talk about recommendation 2. All recommendations are available. Simon didn't mention that earlier one by one, but we have the recommendations upcoming. We can share them. But we outlifted 3 of the recommendations. So Svetlana, you're going to talk about recommendation 2. Start early is the message. The transition process should start as early as possible in early adolescence or directly after diagnosis in adolescent onset disease. And we formulate for you some questions you can discuss. And after 30 minutes, we will share the key findings of your subgroup. So if you would like to set them on the flap over, it talks a little bit easier. Lucy and your group are going to talk about recommendation 6, know the rules. There should be a clear written description of the multidisciplinary team. I think it's challenging because who is in the team? And your table is going to discuss recommendation 7 with Simon. Transition services must be young people focused and address the complexity of adolescent and young adult development. Okay? Can I invite you to go to the tables? And we ask you to discuss this and share your key findings on the flap over, and we're going to feedback them in half an hour. Okay?
They should be able to speak loud enough.
Do you want this one instead?
I should be okay. Can you hear me? Can you hear me?
I think we should speak in that one, right?
Yeah. So like I said, there's 12 recommendations, and this one I think is a really nice one to take because it's looking at person-centred. And all too often, transition is looked as separate, as we need to move this person from paediatric to adult, whereas actually we need to look at the wider person, and that's why we've called it person-centred, not patient-centred, because, as we said, transition, moving from school to college, you know, a partner, family, a house, so it's everything as well, so we need to develop this recommendation so that we can improve that transition process in the hospital as well as looking at the wider person. So, we're going to draw on the flip charts afterwards to really come up with barriers that we think may stop us from looking at the wider person, and then we want to try and look at how, as patient organisations, we can address those barriers with solutions or practical steps. And look, it might be a nice idea to look at the reality, what we can practically do, as well as, in an ideal world, with lots of money and lots of support, what we'd like to do if we could do the best thing, really. So it'd be nice to get everybody's opinions and ideas. And does anybody want to scribe, or are you happy for me to scribe on the flip chart?
You can do it.
So I'd like you to feed the discussions. Oh, you can scribe if you wish to. I'll write up the title then. Recommendation 7. So really trying to think about addressing the complexity of adolescent and young adult development. What do you think you could do in your organisations to facilitate this process? And what do you already do? You know, there might be some great examples already that we're not aware of.
Should I turn it? So in Denmark, we've been working with the big hospital in Copenhagen, where they are starting to do this kind of the same things as in the Netherlands, transition guidelines, and make a task force for it, where they are they've been having a group of, I think, 10 young adults to do the whole trial process, where they stop pampering, nursing them so much as you would be in a pediatric thing, and then make good guidelines to actually get them into it. And we have members on that task force as well, so I'm not personally on it. I'm from the wrong side of the country, so but we see them getting more into it, and they really say it is an improvement. So I guess this is really working, and if the whole project really works out, they will make it all to all the hospitals in Denmark.
Okay.
So fingers crossed that they will do it.
Anybody else have any? I really want you to shape this, because it comes from you. We sat on the recommendations task forces, and we said, do we represent individuals having gone through transition relatively recently? And in the UK there's a lot of information about transition, but I had quite a negative experience, and 1 minute I was in the paediatrics, the next clinic I was in the adults, straight away. So even though we've got this information, it's not necessarily being translated into practice. And the UK's got a lot of work, so it's how we build that support network around. And like the other recommendations says, start young and early, building them skills. And what do you think about the skills that you need to grow up and to become an adult? I think it's all part and parcel.
I'm a parent in this, and yesterday we had another workshop, and then we talked about coming out, virtually coming out. I think if you're going to talk about you know, how to give them tools to make the transition and to go forward. One of them is to learn them very well what the world entails. It's very difficult at times to express exactly. If I look at my own son, you know, it depends completely on the school they're going to. If you're saying that you're sick, because on the outside you can't see if you have anything most of the time. But they are very tired, so it's difficult because other children say, "You're just lazy, you know. Why should you're bullied? And if you're saying I'm sick, they don't understand, etc. I think it would be very good to for young people to form a sort of community where they learn each other how to deal with things.
I'm going to start writing down.
Yes. That is something. My son was alone. You know, he didn't have anything in his group or anything else. So he felt alone. That's a problem. You need some sort of... And it's up to young people to build something like that.
But I think that we do have such a thing in the Netherlands, right? Like, as Lucy told us, like, we have the website of Jong en Reuma, and it's really providing like all the tools and information that you like want to have when you're in the transition phase. I think it's like all subjects, like about school, about work, about information that young people really want.
A few years ago, it wasn't.
No, obviously, but it's like really, I think like such a thing as a website is really helping for young people.
So to try and structure the conversation, it's my plan to look at the challenges that we're facing. Yeah. What would the dream be in an ideal world with lots of money, the support staff is available? But then practically, what can we do together to help that? So, in terms of skill set and education, would you say that is a challenge?
Yeah. At the moment? And you know, there are a lot of countries where these possibilities are not there already.
Yeah, definitely.
So it has really to be.
Yeah, but that's like the dream situation that every country does have it.
Yeah.
Yeah, every like member country can do it. Yeah.
And in terms of how it's delivered, what was the dream? What would be a dream to have education delivered?
Like you had some materials you can actually like transfer back to your like own patient organization and like give out like also like we were closely to the parent organization in my association, so we like build together, especially on the teenage weekends we have, like then we have a 2-3 hour sessions where the parents and the children are together, so they actually get the same tools and learn to talk, and also like parents get to talk to some of our like me, I'm older, so I kind of did the whole thing. So also like you need to learn like you shouldn't pamper them, like you need to be your own, like that's why I wrote the like responsibility, because the child itself need to take responsibility of the disease, because and it's hard.
Yes, I know, and it's very hard because you see your child and you
see them in pain,
a sense of a sense of you know, as a parent you have a sense of it's my fault. That is very strange, but parents also have a problem because, and that's why sometimes, you know, you see that parents are too protective because they want their child to have the best of the world there is. It's difficult. I had the whole transition as a parent, you know, and my son is now independent, lives on his own. Of course, we still make sure that he has things. One of the other things I think that is important is that they have the chance to be independent, and I mean materially independent. What I sometimes, is not bothering, but a fear is that what you see is that they're not able to work 100%. So where do they get the money to have a full? You see that social services are going backwards, and the ones being targeted are the people who are sick, who are chronically sick. That means that it gets more difficult to have them live on their own. You know, you're not alive as parents for years and years and years. Sometimes it ends. That is something that is in my mind as a parent also a problem. The thing that, and I think it also is a part of the transition. It should be a part of the transition. Making sure that they are able to support themselves in the future.
And how do you feel, because we're talking about transition, support for young people, how about the parents as well? You know, because the parents looks after that young child for a number of years, and then how you felt in terms of letting go, perhaps in the clinic when the doctor starts to address the young person, or ask mum or dad to wait outside.
Yeah.
And perhaps the parent can feel, where's my help as well?
Well, you know, the first concern of us was always the child. I did feel very angry at times at doctors saying we can't do anything, etc. You know, in this time when medically so much is possible, it sometimes is painful to see that not everything can be handled. So for a parent that is difficult if you look at that side.
Can I also add like a challenge? Because I think we have the skills and the education, but we're still missing something with the rheumatologist, like transferring from one to another. It's like the hospital should do things about that. It's not really on the patient itself. It's like also
So like the structure or the...
the structure.
That's also kind of a dream, like
Yeah,
getting them
definitely
actually
dream,
to talk
but it's-
together, like from the beginning, like maybe
Yeah,
for
like
a
the
couple of
two
years you have
rheumatologists talk
two
together.
following you,
Yeah.
and then like, okay, now you're 18, then we can do the whole transfer. Because
It should be a good transfer.
it would be like great for you, like 16, 17 to start moving to the new rheumatologist, but in the beginning being together.
So, I mean, when would you think should transition start? How do you think it should?
I would say from 15,
Yeah, or 16, 15.
15, 16.
So would you say that's a dream or a reality?
It should be a reality,
It should
but
be a
it's still a
reality.
dream.
So we try and...
If we're talking about patient-centered care, shouldn't that be something which is custom for each individual? Because you find individuals who are ready to transition at 15, and you'd have individuals who are ready to transition at 13, for example.
True,
or 14.
definitely.
So I think rather than saying 15 is a name, or there should be a guideline for sure. But I mean, I think whoever the clinician or the person who, or the patient himself in consultation with the patient, there should be, you know, a decision taken whether it's the right time to move or not.
Yeah.
Rather than.
But that's
setting
definitely a
clear
dream.
That is definitely a dream.
Because it depends on the person.
Yeah.
Like
Very much depends on
some
the
are
person.
ready like at like 14
Yeah.
almost to go to the adult one, where some will like never be ready, kind of, and get a shock moving to it.
So, yeah, I mean, and the whole purpose of this is the transition recommendations to be young person and adolescent appropriate for the developmental age. And as you rightly said, some people at 13 are ready to take responsibility and ask questions, and somebody, you know, I remember somebody in the children's still aged, I think 23 or 4, and they were still in the paediatrics.
Whoa, can you be? I didn't know you could.
It was a safe environment.
Yeah.
And that is, I think, another challenge. I mean,
Yeah.
from what we see from our area, there's a big difference between going to the pediatric units and going to the adult rheumatology clinic. When you go to the pediatric, the environment is one main the attitude of the staff. They're trained to deal with children. But eventually, when you move on to the adult section, it's purely, and the rheumatology model at least, it's more an elderly type of situation.
So that's saying the actual training of
The actual training of
doctors.
the staff, the actual pressures they have on them because of the sheer amount of cases they have to handle. I'm not saying that all their patients shouldn't get the care that they need, obviously not. But I think younger people should get a different kind of care maybe. Could be a question of attitude as well. Due to the pressures, due to the environment, and so on and so forth.
It reminds me a little of the discussion we have in the Netherlands about when children are able to decide if they want to end their lives, yes or no, if they are critically ill. At this moment, I believe it's at 12. But the discussion is already going if children from the age up to 6 are able to decide if they want to end their lives if they're critically ill. So I think this is one of those things at which age, what you mean is at which age are they able to make their own decisions in this?
Because the decision is very different.
Yes, I know, but you
the
expect a child to be
but the challenge
able
is the same at the end of the day.
to think through the whole process, know what the treatment will be and what the effects are.
But I don't think this is like about the treatment choices. It's more about when you
transition between.
when you're ready for transition, and I think they can like decide that because they know if they want to go to like an adult rheumatologist or like.
Well, it would help also if they get to know the adult rheumatologist at least from beforehand. It would help
Maybe like combined appointment or something.
That is what they're doing in Copenhagen, where like for short time. I think it's like 2 or 3 times.
Yeah, but that's really good.
Where they have both, they will like also like in the beginning it's just the nurse from their adult department, but then they will like introduce the other one as well. So
it's a joint clinic.
Yeah, it's a like special department they made for this.
And I think that's just bridging between the stream and reality.
Also kind of what Judy, Judy, yeah, what she said, like what they're doing, having the one person like helping, like taking the child and like now you're adult. So
an actual coordinator.
Yeah, I mean, a coordinator would be really great.
Yeah, that would be having somebody who's in charge of this, taking ownership of this process. Somebody who takes ownership of the process and then leads the various professionals into, this needs to be done, this needs to be done.
You're working hard here. How are you doing?
We have Simon, so
it is great.
we're going hard.
Don't leave him out of my sight. So.
And in terms of the transition coordinator, who do you think that could be or should be?
I would say nurse, because they will know you the best.
Yeah, but I think like someone like Lucy could also like.
Oh yeah, but she's
she's a nurse.
Yeah. So yeah, but that's
somebody
a nurse that has an aptitude for that job.
Yeah, because you can't put anybody to it because like some of the nurses at the adult ones are like.
Maybe also a young someone who's
probably
young,
a younger
like,
one would also
be
because
nice.
they like it's not a long time ago
or at least
we're teenager. Yeah.
I mean, and I don't know, in a real world, what would you think of perhaps somebody like from a patient organisation with direct experience? Do you think that would be beneficial or not?
My fear would be the lack of resources.
Yeah, the whole volunteer part.
You can't rely on volunteers to do, or rather, you can rely on volunteers for a lot of stuff. But I mean, this is kind of a critical process, and you might need to have professionals in there to do this job rather than having somebody, who, regardless of the training, is doing it for free. Personally, I would be more comfortable having somebody who's paid to do the job, who's accountable for that job, and who's giving the empowerment to the job and somebody who's a volunteer who is there one day and might decide next day to leave. I mean, still, a professional can do that as well, but I think it could be a bit more managed.
But I also think the patient organizations comes in here because like you should have some tools in the organization like to like inform people how to work, but you need the professional one.
Definitely.
But like we use like especially on our teenage weekends and stuff like that, we like tell people what they need to expect, and like the rheumatologist department is way different than the like pediatricians, so we're telling them that and informing them that way, and using older patients' experiences, and not telling them the worst case scenario, but the good cases, so they don't get too scared.
I think the success stories should be shared as well.
Success, exactly.
Because I mean, in this world, I mean, it's easier to see the cases of failure, the cases of people who have, real problems and they should be heard and everything. I'm not saying that. I think success stories should be shared as well, because young people, especially if you see someone who's been successful, has a rheumatic condition, has been successful, has maybe, formed a family and kept on moving and had a career and so on and so forth. I think it would help them because it would make them, in English I say look up. I don't know what it is.
Yeah, look up to somebody.
Look up to somebody. I mean, maybe it's not the correct phrase, but I mean, at least have a role model and say this is what I aspire to do. I think it could be helpful.
Just to look on this last point that we made about training of health professionals. I don't know, what are your views on whether adults should actually receive some paediatric training in rheumatology? Or what skills do you think they need and who could educate them? Could it be patient organisations?
We actually did that for the rheumatologist business community, where me and James, I think you met him, maybe we were presenting, we're like educating, like, okay, this is what you need to look at when you like are meeting the young people. Like, we don't just need the medicine, we also need to know like we can study and we can make our life work, and like family life, how would that work, everything, like all the transitions will meet from 16 to 30. So get the nurses to know that.
So you actually meet the nurses, you hold a
like
seminars and this kind of stuff.
When they have what we call it, like theme days or something, the nurses have that like a couple times a year, and then they will ask us like, do you want to come present for like 1-2 hours? And we will go there and tell them about our own experience and talk about members, both good and bad transitions, to make them like know what is really good and what is not that good. Because it is hard for them. Normally they will probably meet people plus 50, 60 are the main patients, and then they have the younger group as well. So if they're not used to that, it's hard for them to include them. So we find that really helpful. And they're always really grateful when we've been there. It's like, oh, that's an eye opener, and
it'd be nice if you could show like a case study of it, because I think that's a great tool to actually sell to other countries. Because I know in the UK, I'm not entirely sure whether that happens.
Of course, it's not all news at the same time, because they can't take all of them out. But yeah.
But like these service courses that they have.
Yeah.
But I think the last time there were like 40 nurses there from all of Denmark. We just like got together in the middle, like between the two islands, and we were presenting there. And I also found it really helpful to like meet the nurses there, because they also hear them talk together, and also like give them a case, like how would you do this? Like you have this 70-year-old coming to your new department, like how will you approach them? Not role playing, but like give them tools to
like scenarios.
Yeah.
Just in terms of medical training as well, adult rheumatologists, when they're training as doctors, have a rotation on paediatrics, but then when they specialise into adult rheumatology, that is all they do. So I know one of the questions another patient, when we were doing the recommendation set, is as part of medical training, should adults have a block, whether it's 6 weeks, 3 months, in the paediatrics, and should the paediatrics have the block in as training as an adult? So, because we all, I know, and to do both ways as well, I mean, what do you think about that? Do you think that would be beneficial or not? And then I guess I know money, resources, and things, but
Yeah, but like,
Policies.
I guess dream scenario would be like that because that will give them some like insights in how does it work there and how does it work here. What do we need to do to actually fit all the pieces together to make the transition good? But I guess that's a dream scenario because, as it already is, like there are lacks of rheumatologists and
that's, I think, as organisations we can actually help to influence, you know, the future training of medical doctors. Because things can change, you know. To innovate, you must change. So
true.
These are really healthy discussions.
Good job. Good job. I just talked. Where are you guys from?
Malta.
Malta. Oh wow.
It's a small country.
Yeah, that's kind of wow. Like I think that's awesome.
Have you been there?
No, but I always wanted to go. It's one of the they're like especially at the Grand Prix. What is it called? Like the musical thingy. Malta is always really good, so I kind of want to go.
I mean, I think we could go on for probably hours.
What?
I think we could go on for hours talking about these different things, but do you think that provides a basis for further discussion and, you know, so we move away from the conference to try and actually look when we go back to our own countries to see what can we do to try and influence this? I'm pretty happy with that.
Yeah, I think so.
Does somebody want to feedback as well? So it's not just me talking. I'm looking at that's what your impression.
Like even though we are pretty far with this, we still need to do a lot of work because I think it's like I was kind of lucky. I got as a 16-year-old, so I was just put into the adult one right away. Yeah, but we have a lot of like having since like 2 years or something, and we really see them because the parents are so protective of them. Like it's so hard for them to actually be like all the independence and everything like that. So we really need to focus more on the parents.
And I think naturally you get some parents who are really supportive and want them to become independent, but then you do have some parents who just want to look after the children and they are very protective as well, which is
Because
good and bad.
it's a good thing. You should be protective, but you should also know when to take a step back and actually let your child and teenager be their own person.
That is actually something that maybe as an organization we should be working on, like educating parents, not to know their limits. I don't want to use the incorrect words, but educating parents to know when they should let go of their children. At least as parents and as families, we tend to be very protective of the children, and I think even from our own experiences. If it takes a lot on the parents for them to let go of the kids. So that could be something which as organizations we could work on as well. Educating the parents, letting them know how much important it is regardless of the state of health of the children, to make sure that they will actually do the transition to parenthood rather than being overgrown children. I think it's something which as an organization we could work on.
Because like you shouldn't like the parents really need to know the difference. But like you should push sometimes. Like you have a good day today. You can take your bike and ride to school. I don't have to drive you every day. Like, but we see kids like up to 18 being driven every day because, oh, my poor child has like some kind of rheumatism and like, oh, it's so sorry for them. Where you actually end up doing them not a favor, but like a bad favor.
My mom used to write me the homework because of my hands.
Yeah, of course we have different like
yes.
challenges in that way, because like
It's not good.
like we also have kids like in wheelchairs, and then you can't take the bike. So, but like still let them be on their own as well.
Yes.
Like give them activities besides everything, and like make them independent. Because also to be a strong patient or give this person something, you need to be strong, at least in Denmark today. Because if you don't like push yourself, you won't get better.
Heart needs to be strong.
Yeah.
Oh, we...
Feedback to the group.
Maakt niet uit, weet je
What?
zelf.
Does somebody want to feedback to the group?
You can do it.
Somebody else would like to do it, or somebody else wants to do it with me.
I can do it with you. I don't want to do it myself.
Like, you want
But
somebody else to get involved in.
yeah,
Yeah, we can.
yeah, we can also like.
Maybe we can do it together then.
Yeah, we can do it together. You can
do
sit
it
down.
together.
Okay.
We should sort of
I want to make the connection of what you've talked about in your subgroup to a plenary feedback. And here there was a lot of discussion. I start with you, Svetjana. Because you talked about, with your group, about recommendation 2, start early. And I had a microphone, but where did I put it? If you know me a little bit better, you know that this is my life, that I lose everything. We found it. Okay. Svetjana, you talked about recommendation 2.
Yeah, the process should start as early as possible. So
But you face some challenges because the Bulgarian situation is...
I will say slightly different because maybe some of you will get the impression that things are quite poor. We should admit that there are some points that things are not that bad. And we just were talking with people who had experience, so they are really impressed by the specialists who are taking care for themselves as a person, or experience of a parent who has a child with rheumatic disease. So the care at a really early age, when people are children, it's brilliant. It's really a person-centered, with personal attitude, with all the care we would like to accept, to receive, even as older people. Mm-hmm. So at that point, I heard only positive things. But there is the but. Also in Lucy's presentation, we saw that it's quite important to accept that transition not as a moment, but as a process. And people who has their personal experience being with rheumatic condition from their childhood said that it's quite difficult when you are 16 or 18 just going to the other clinic, meeting the other rheumatologist, and sometimes it's even stressful because you are meeting also people who are with advanced condition, and this could be stressful. This could make you feel miserable because you definitely start thinking that this is gonna happen with you. But we all know that if things are under control, this might never happen. So it was really a hot discussion on the first question, when we should define who were the people, not people only, but the team involved in that process. So we agreed that there is a medical part, where definitely the rheumatologist taking care for the children, but also pediatrician and rheumatologists for elder people should start meeting from time to time before the time when the young person should go to the real rheumatologist. So this is the medical part. I will not mention other health professionals, not because we don't think they should be involved, but because in Bulgaria we don't have at the moment, but we hope in the future we will start having such, we realize how important is this rheumatology nurse, because we have nurses, but they are really supporting team, and they don't have this right to see the patients in their own. So the medical team is clear, but then
patient organization.
no, I want to say in that process we start talking also for people who can help a lot to the child and their parents. Could be older brother or sister, because it's not only medical condition, but it's also changing in and definitely some social person who can support with education. We are calling it pedagogue, social pedagogue. I think, and some kind of psychological support. Then on organizational level, we think that we can try to contact and find the most appropriate people for that, because we all know that it's one thing to be just psychologists, but it's totally another thing to be a person who can work with a person with rheumatic condition, because as we just mentioned, at that point for the young person could raise questions like, am I able to set a family? Am I able to have my own children? How can I be a person who can enjoy the things in life, like even sexual life, like my like people at my age. So this should be a specific person, not only with psychology in his background, but also with his experience with exactly that type of people. So we are thinking that as an organization could be the people who can contact, who can try to find the right people and make them as system, working as a system, like this.
Focused on
focused on this.
But may I ask you something? Do you think that this should be a healthcare professional, or could it be an expert patient who've been through that phase? You told there is a lot of experience on your table with
I think
experience this phase, and they can help another youngster who is facing growing up with a rheumatic disease.
I think could be, because even Bujdar was the person who said that we can do this, meaning people who has past that process, but it will be also good to contact people with the right
special
education.
Okay.
And our dreams.
But you faced the dreams and the reality here. There also, but for you it's a little bit difficult.
That was my intention, to say that all the time when we were planning the things, almost everything was in that dreaming direction, but we are optimists, and we are hoping that this became true.
I see and I heard a lot of discussion here and a lot of power. So
Yeah,
I think the energy is there.
Yeah,
But now the possibilities.
Yeah, and
what concrete step can you make? Did you discuss that?
Yeah, we discussed, but maybe we did. We wrote it. We think we started with great ambition, but now at the end we said that it will be very useful to translate, adapt recommendations once they are ready, and that will be to bring to the all engaged persons and try to start working to build our dream.
Yeah. I think it's a beautiful framework and you can discuss it or use it as a guidance, but you have something on paper you can show already.
We can refer to and make our wish stronger.
Yeah. But you also experience these days some experiences from the other youth groups in Europe. Are there things around this topic of transition you can take home, what you experience?
Definitely, definitely.
Okay. Thank you.
Thank you.
Yes, thank you. Well done, hard work. Simon, this table, you also worked hard. And I noticed there's one column is a little bit empty. Reality. Maybe you can share your thoughts, because you worked on, I set the recommendation on the slide, you worked on 7. Person-centered.
Yeah, well, we first thought about the challenges, and we think the most important challenge is the skills and the education of the young people. That, for example, like knowing how to cope with things and like all the education you need. Well, it should be available in tools, the information like we have in the Netherlands, for example, with Young and Reuma.nl. I think there are a lot of information that is really helpful for young people, and we thought that it should be like available in every country in Europe. That's like our dream, our first dream, that it should be everywhere. We also think that face-to-face contact is really important to help with the transition, and they should. Oh yeah, we also had like the part about being parents, because that's also really important that not only the young people get the information, but also parents, because they're like, they had to let them go, and it's really an important thing.
There's also, you shared some of it, and we talked a little bit further on that table, but there's also an important process over there with the parents and the carers, yes.
Yeah, so we found that out too.
Yeah, I think that's good.
Well, okay, I will go on. Yeah. Another thing we talked about is this whole independence thing, like how you will actually be independent. So a lot of like education on this is also one of the dreams, where you like get all the tools you really need, both like as a patient, but also for your parents again, to know how to be independent, but also the healthcare professionals to actually learn how to cope with young patients, where we educate nurses in Denmark, like on like we go out, talk to them, like say, okay, you meet me as a young person. I'm not that young anymore, but was young at some point.
But you're able to discuss it and to share your
and then we give them like bad cases and good cases. Like, how would you handle like a case like this? And could you do something different, and that way around?
Do you hear the connection? Yeah.
And then we talked about the whole structure of like, especially the rheumatologist. What, like, again, a dream scenario would be you have the one from the adult department going maybe 2 or 3 months into the pediatric department to see how are we treating the kids there and the teenagers, and also the other way around. So for the one from the pediatric to go to the adult one.
I think it's really a good one, because that's really an eye-opener. Yeah.
Because it will give you this. Yes. And then we talked about whole like when should you start the transition, where like you could make some general guidelines because somebody we talked about some will be ready around 14, but other needs to be at the PTA to like 23. But we will hope like I need to stop.
No, it's
like it would be optimal to be like 15, 16 and starting it, and maybe have sessions with both the adult rheumatologist, but also with your normal one as you have as a teenager, and then like start to know how it is to be at the adult department.
The dream would be to like see it. We thought that the dream would be to like every person is different, so that they could like decide it on their own. That would be like a dream to like individual choices.
Yeah, I think that's great. Yeah.
Yeah, and then in general, the whole like training of a healthcare professional is really key, but also the pressure of.
And what do you mean with pressure?
I can't remember that.
Pressure, depending on the caseloads that they have at the time they can give out to young people, because at least in our country there's a huge caseload of
A caseload of
the rheumatic professionals, the doctors, the healthcare professionals. They see a lot of cases, so maybe they can't dedicate enough time.
Okay, so maybe someone who support them, if it is an expert patient or someone like Lucy, could help the caseload and make also healthcare available. This was some topic also yesterday. We heard from Ireland a strong pledge for more health professionals, more awareness.
Yes.
Okay, do you have one thought you really want to share? Because we're taking this also with us after the 2 workshops. There's a plenary feedback, and we will share your thoughts also with the group, the whole group, okay?
Yeah, we talked about you need a coordinator for this, kind of like your job, like having one taking like.
Now
patient,
it's
like,
your time,
okay,
and you.
No, let me take you first
take
step,
you.
and whoops,
Oh,
next
sorry.
step, and everything. Like
Yeah.
having a person supporting you that way.
Okay.
That is really important.
And could it be someone from your organization, the patient?
We talked about that, like. Resources. We will be informing because like we have our teenage weekends every year where like 12 to 18, it's crazy with all those kids, but like we have 2 or 3 hours every time where the parents are there as well, where we will try to educate them on like how should you do this, and
you make them aware of what
like okay, you
reflective,
especially when you will take the older ones out, like okay, now you're almost an adult,
okay,
so you need to be aware of these things and the thing, and like also parents like. Now you need to let your child go. Like,
you make them aware, doing things, but also reflect on it. Okay.
Yeah.
Thank you for your thoughts, and well done. Okay, the last group, and here was also discussion. Lucy, can I give you the? Lucy, you talked about, you talked about recommendation 6, know the rules.
Yeah. We talked about who are the members of this multidisciplinary team. And first we thought, there must be a pediatrician, a rheumatologist, a psychologist, especially for the parents, a nurse, a physiotherapist. But then we thought, whoa, that are a lot of persons, and where is the patient? And who is the key person in this whole process? So then we thought, okay, there must be 1 or 2 key persons. It must be patient-centered, so the patient is in the lead, and what does the patient needs in this transition process? And then we talked about peer-to-peer support, so maybe there could be also 1 patient who is giving the guidance to the patient and give him like a role model in this whole transition process. So maybe there could be a nurse who is giving some guidance, and a patient who is the role model in this process. And then point 2, how can your organization support the transition? The organization can support with education for the parents, Also to help the parents with letting their young children go, and also with education for school, and also for the youngsters themselves. And then which possibilities did we see? We see peer-to-peer support as a possibility, like using role models in this transition process, and also patient-centered care. But a barrier could be also in this peer-to-peer support that there is a stigma around doing things in like patient organizations, such as going on a camp with other youngsters with the rheumatic diseases. We heard that some people think it's difficult. They don't want to be on a camp with some chronic ill person. So there could be a role in the also in the medical centers, but also in the organizations to throw away this stigma. And this is also a dream. So if the stigma can go away, and we can support parents with letting go their young children, a psychologist could also help with this. And then we can stimulate peer-to-peer support and seeing the patient as a role model in this transition process. I think this is it, right? Or yeah?
Yeah, thank you. Okay, we heard a lot today, this morning, a lot of experiences, discussion. I see some connections upcoming. The cultural aspect, what we sometimes experience in the Netherlands, where youngsters who participate in camps or meetings think, is this something for me? And your experience, I look at you from Denmark, when you say we have camps and everybody joins it, also parents, so it's good to hear what is that cultural, or is that the form or something? It's good to share that. And I think the overall conclusion, I can't make it. I can only pronounce and translate your key findings, but I hear a lot of empowerment from you as organization. And for us as healthcare providers, that is great, because I think there must be a connection between the healthcare organization and the patient organization, especially in this subject where youngsters learn from other peers. It's known from psychology, from development science, youngsters learn from each other. So if we can help each other to do that, I think that is a first feasible step to make. And it's not so difficult, because nowadays we have a lot of social networks, Facebook, Instagram, you name it, your youngsters are on it. So we talked a little bit about it yesterday evening, how much this was used. So maybe this one of the feasible steps other patient organizations already taken. So thank you for sharing your experiences, and thank you for your energy. And I would really like to encourage you to take this further to your country, but also today and maybe a little bit tomorrow. And I want to end this workshop now, because it's 10:30. And I want to invite you to the coffee. And I have to tell you strictly from the Eular organization that on 11 o'clock the next workshop is starting. So thank you very much.